Hello there. I am Nikisha Killings, MPH IBCLC, and I am here today with my co-good troublemaker, Nikki Hunter Greenaway. Today, we're going to talk to you about how to become an IBCLC. We are brought to you today by Lactation Education Resources, who kindly makes this video as well as tons of other education resources available to anyone who's aspiring to become an IBCLC or just a more effective lactation supporter. Take it away, Nikki.
Well, guys, today we're going to go through all of the pathways. We're going to discuss what you need, what you don't need, and everything in between.
Let's start with our journey map. If you're here, then you're trying to find out more about how exactly do I get to the exam and become an IBCLC? Well, here is your map. Starting in the bottom left-hand corner, you'll see that you have to begin with tons of education. Health sciences education and lactation education will be required. You have 8 higher learning courses and 6 continuing education courses, and then 90 hours of lactation education that you can get from Lactation Education Resources, of course, and also 5 hours of communication skills, also available at LER. The next section is clinical hours. This is what determines what pathway you're on. Pathway 1 is for healthcare professionals or volunteers. 2 is for someone who's in a school program that includes all the pieces. And 3 is for someone who's shadowing an IBCLC. Once you get all of your clinical hours, all of your education out of the way, then and only then are you able to sit the exam. After that, of course, when you receive your passing grade, you're now able to go off to work in the setting of your choice. But first, all the components that are needed.
All right, so let's talk about the health sciences education. You need 8 health education courses. So that includes biology, human anatomy and physiology, infant and child growth and development, introduction to clinical research, nutrition, psychology or counseling, or communication skills, sociology or cultural sensitivity or cultural anthropology. All of these courses must be completed from an accredited institution. It can be online or in person. You need to obtain a passing grade. There are no letters, just you need to pass. Minimum 1 academic credit session in length. Most courses cover topics in about 25 hours. Content must be on the subjects listed in the Health Sciences Education Guide. For example, for some of the healthcare professionals, you may find that your class covers human anatomy and human physiology together. Make sure you keep all of your syllabus in order to see what fits. Now, we move on to our 6 continuing education courses: basic life support, which is CPR, medical documentation, medical terminology, occupational safety and security for health professionals, or OSHA, professional ethics for health professionals, and universal safety precautions and infection control. These courses are offered by, again, institutions of higher learning, or they're just considered continuing education courses. They may be taken online with the exception of basic life support. Now, unlike your clinical hours and your lactation education, these courses never expire. You can take them whenever you need to and take them along your journey. Now, lactation education courses. Complete at least 90 hours of education in human lactation and breastfeeding within the 5 years immediately prior to applying for the exam. This includes in-person presentations, online education, distance learning, and independent study modules. In addition to the 90 hours of lactation-specific education, you need 5 hours of education focused on communication skills. Now, remember, lactation education is more than just constantly giving, teaching client stuff. It's also about listening and effectively communicating with our clients.
So if you are on pathway 1, that means you're either a healthcare provider or a breastfeeding support counselor. Clinical hours total 1,000 hours directly supporting birthing parents and babies. That means if your job or your volunteer capacity allows you to work directly with parents, supporting them in their breastfeeding journey, you can count those towards your 1,000 hours of clinical hours for pathway 1. And then, of course, you have to get your lactation education and your health sciences education. Once you get all of this, you're ready to apply for the exam as a Pathway 1 candidate.
So let's talk about the recognized healthcare professionals. So that includes a dentist, dietitian, midwife, nurse, OT, PT, pharmacist, a speech pathologist. And I also, this list is not totally exclusive to just these on there. You can contact IBLCE and see if your profession qualifies.
Yes, similarly, there is an exhaustive list of recognized breastfeeding support counselor organizations that IBLC hosts. Please contact them if you're wondering if the organization you volunteer for counts as a recognized breastfeeding support agency. So, if you are volunteering and getting your hours or working, getting your hours supporting families, both birthing parents and babies in breastfeeding, either paid or volunteer, you can get hours in one of these settings: hospital, birth center, a community clinic, which absolutely includes public health facilities like WIC, lactation care clinic practice, so working directly with the lactation consultant, or in a primary care practitioner's practice or office. All of these are settings that do qualify if you're volunteering or getting paid for your breastfeeding peer-to-peer support in helping families breastfeed. Pathway two is a little bit different. We often joke about how this is like your fast food meal. Everything is included: your drink, your fries, everything is included in Pathway two. This is a program that is all inclusive. Who qualifies for Pathway two? Well, anyone who applies and is accepted to a comprehensive accredited program in human lactation and breastfeeding. You get 300 clinical hours directly supervised within the program. You also still have to get your lactation education, which is also typically included in the program, and health science education. For some is included, for others you have to come to the program with them already completed as prerequisites before applying. So what are the accredited Pathway 2 programs? Well, there's a handful here in the United States. First up, UC San Diego in San Diego, California, Northwestern Technical College in Rome, Georgia, Henry Ford College in Detroit, Michigan, Johnson C. Smith University in Charlotte, North Carolina, North Carolina A&T State University in Greensboro, North Carolina, UNC Gillings School of Global Public Health in Chapel Hill, North Carolina, Union Institute and University in Cincinnati, Ohio, Portland State University in Portland, Oregon, and also Drexel University in Philadelphia, Pennsylvania. Please note that the programs that are in pink do offer distance learning. You may be able to attend some or all of the program online through distance learning. Check it out and see what, if any of these work for your needs.
Last but not least is pathway 3. Now, there's a joke with this pathway as well, is that this is the DIY. You're going to put it all together yourself. But who qualifies for this? Any aspiring IBCLC who is able to have an IBCLC supervise their clinical hours. The clinical hours, you need 500 clinical hours directly supervised by an IBCLC in good standing within the 5 years preceding the exam. So notice the time limit on this. You have 5 years before the exam. Lactation education, once again, your 90 hours, and then you need those 5 communication skills. And then last but not least, your health education courses, you need a total of 14. So what are your next steps? What are you going to do now? You know all the pathways, you know what's included, and where do you go from here? Well, you need to map out where you are and how to get there. How long is this going to take you realistically? It may take, 2 years, and because you may be at a different point than other folks. It will take however long you need to get what you need.
It's important to really be aware of where you are and how to get there. Once you have that all mapped out, think about what you need to do today to best prepare to reach your goal. Make sure you follow Lactation Education Resources and Nikki IBCLC for updates and resources to help you on your journey. We're so excited that you're starting. We need you in the field. Come on, come on. Follow us. We'll get you there. Take care.
Thank you.